SCVD, or superficial chronic venous disease, is anchored in the principle of chronic venous hypertension. Chronic venous hypertension within the superficial venous system of the lower extremities, otherwise known as the saphenous system, then results in deoxygenated blood accumulating, which then can lead to valvular degeneration and insufficiency. This toxic deoxygenated blood, predicated by the hypertension within the venous system, then results in endovenous damage and dilation of the lower extremity veins, which then leads to further propagation of what we know commonly as varicose veins. These varicose veins are really a sign and a symptom of the hypertensive process, which can then lead to soft tissue edema and potentially chronic venous ulceration. The risk factors associated with SCVD, or superficial chronic venous disease, can be broken up into two main categories: genetic predisposition and environmental factors. Typically, women who are older, multiparous, in other words, having multiple childbirths, and with a strong family history of varicose veins are predisposed towards chronic venous insufficiency. There are also other types of genetic factors associated with other types of venous conditions, such as pelvic congestion syndrome, varicoceles, and vascular malformations that can also lead to varicose vein formation. Ultimately, what we say is that approximately 1/3 of the contributing factors associated with superficial chronic venous disease are genetic in nature. The second category, environmental, actually has to do with a lot of the lifestyle choices and lifestyle components that result in chronic inflammation of the veins due to venous hypertension. Prolonged standing, professions that require prolonged standing, such as nurses or physicians or other people that are not moving around just in a fixed position, vertical position, and those people that have experienced either trauma or previous injury to the lower extremities may also be predisposed towards varicose veins.